Namaskar, I am Dr. Saptarshi Banerjee. I work in AMRI Hospital, Bhubaneswar as a consultant intensivist and pulmonologist. Today, I am going to speak about bronchial asthma. As all of you know, now is the winter season and we receive lot of patients having problem with bronchial asthma. Now, what is bronchial asthma? Bronchial asthma is basically a disease of the airway in which there is hyperreactivity and inflammation of the airway. The airway is very sensitive to the cold air that blows in the winter season, as well as the pollutants and the dust that are generated during this dry season of the winter. These irritate the airway, and patients who are having bronchial asthma often get airway spasm and get sick and come to us for treatment. So there are certain preventive aspects which you can take during this winter season. First of all, while undergoing exercise, you can avoid the cold air which goes inside your respiratory tract and irritates the airways and precipitates a bronchial asthma. So warm up the internal environment, especially if you are in a gym. Avoid air conditioning during this time. The second factor as preventive aspect, you can use mask during this time. As we know, we are habituated with masks because of our behavior for the last 2.5 years due to COVID. Masks helps to eliminate the dust and the airway pollutants that are generated, especially if patients are very sensitive to pollen and small mites and dust that are generated in the air. The third aspect is take your medicines regularly. If you are already under medication for bronchial asthma, kindly take your inhalation regularly, and if as prescribed by the doctor, of course. And if you feel that your medication is still having problem, you are having increasing in respiratory symptoms, kindly follow up with your doctors. We in AMRI has a team of pulmonologists, and we have modern gadgets like spirometry and modern CT scanner where we can scan and image the lungs to see any precipitating infections. Commonly fungal infections can also happen during this time, especially if there is a construction work going on in and around the site. So kindly contact us and join us for your follow-up and second opinion on your management of bronchial asthma. We, with our modern diagnostic tool and our patient-friendly services and pulmonary rehabilitation services, can cure and stabilize your bronchial asthma. And we also have a very good indoor facility of intensive care medicine. If you are really sick, because sometimes bronchial asthma can be very severe, you can even get admitted in our ICU. Thank you.